Good morning, everyone, and thank you for joining us today for our webinar brought to you by International Bipolar Foundation on genetic counseling for psychiatric illness with Dr. Angela Inglis. Angela Inglis is a genetic counselor and a clinical assistant professor in the Department of Psychiatry at the University of British Columbia. Angela worked in psychiatric research for a number of years, coordinating and overseeing the day-to-day operations for a research program which involves studies in postpartum depression, stigma among family members of individuals with psychiatric disorders, and a genetic counseling study for individuals with psychiatric disorders such as schizophrenia, bipolar disorder, and schizoaffective disorder. In February 2012, she began a new role providing a clinical genetic counseling services exclusively to those with psychiatric disorders and their families in the context of the first and only clinic of its kind in the world. Welcome, Angela.
Thank you very much, Debbie. So I just, thanks so much for asking me to come and speak today. It's really exciting for us to be able to come and talk on this topic, and it is one that I'm quite passionate about. And I just wanted to share that I work as part of a team, a research and clinical team. So I work with Dr. Janine Austin, and she was kind enough to share some of her slides with me today. So some of the slides that I'll be presenting are from both Janine and from myself. So I wanted to start off, I know I have a wide audience with me today, so I wanted to start off by going through just giving a brief background on what we know about genetics in psychiatric disorder. So I know this might be review for some of you, but just want to make sure we get started all kind of have the same background just starting off. So I think it can be really helpful just to talk about how we know there's this genetic component to psychiatric disorders. So first of all, how is genetics relevant to mental illness? So, going back about 500 years ago, it was noted that family members of people with psychiatric problems had a higher chance to have a similar problem than if they were to compare them to the general population. And so in more recent years, these are more formal studies that we have performed. So we know from what we call family studies that if we were to look at the general population, about 1% to 2% of people will go on to develop bipolar disorder. But we know, so when we compare a family where an individual has bipolar disorder, the individuals within that family have a higher chance of themselves developing bipolar disorder. In comparison to the general population. So that might make you think, okay, well, these family studies give us that evidence that genetics plays a role. But one thing that you can't really tease apart is that environmental component, because families often share the same environment. So the next thing that, the next piece of evidence that we looked at are identical twin studies. So what we notice is that when you compare identical twins who have, so identical twins being people who have 100% of the same genetic information, when we compare identical twins, one twin has bipolar disorder, the identical twin has a 70% chance of developing bipolar disorder. So if we'd expected, if it was all genetic, we would have expected that to be 100%. So 100% of the time, the other twin would also have bipolar disorder. So it's not all genetic. But when we compare that to non-identical twins, or people who share about 50% of their genetic information, we see that about 20% of the time, if one of those non-identical twins has bipolar disorder, their co-twin will also have bipolar disorder. So this is much lower than the identical twins. So this shows us that again, it kind of gets at that genetic component, but also shows, because it's not 100%, that we know that the environment also plays a role. And so I just also really wanted to touch on heritability really briefly. And again, because we have such a wide audience, I think often when as a genetic counselor, when I speak with people, I know these are numbers that they come across, and they can cause a lot of misunderstanding and a lot of worry. So often I think people will see, because we're focusing on bipolar disorder, if they come across these heritability numbers, sometimes they may think, oh, well, okay, 70 to 85% of bipolar disorder is heritable. So that means 70 to 85% of my bipolar disorder is genetic. Or 70 to 85, there's a 70 to 85% chance that my child will have bipolar disorder. And this is not true. This is not what these numbers mean. Heritability is a statistical measure of the degree to which the variance in a trait across a population is attributable to genetics. So it's a population concept that means essentially nothing at the level of the individual. So kind of to give an example, so when you look at census data, so for example, like Canadian census data, they might say, you know, on average, the average Canadian has 2.4 children. I don't know anyone who has 2.4 children. This is nothing about the individual family. So it may be that, you know, one family may have 10 children and another family may have no children. So I think really the important thing to take away is that this is nothing about what chances might be for children, and this is nothing about how much of an individual's bipolar disorder may be genetic. So, you know, this is all very much meant to be a very brief overview. So what do we know about the causes of psychiatric disorders? We know that they tend to run in families, as I've discussed, and as I mentioned, they're highly heritable. But the cause of them is heterogeneous, and it's most often complex. Some genetic variants have been implicated in cause, but we don't know all of the genetic variations that can contribute yet. Individual genetic variants are associated with rather than causative of illness, and I think that's really important for people to keep in mind. A genetic variant does not typically confer vulnerability to a single discrete diagnosis. And at this point, many environmental factors have been implicated in contributing to the causes of mental illness. So like different sorts of life experiences. So what do I mean by all of this? So right now, there's no genetic test with which to diagnose a psychiatric disorder. Family history evaluation really right now is more useful than most genetic testing for predicting risk for psychiatric illness. In rare cases, genetic testing can make sense, but this is often in cases where people have other medical problems as well as psychiatric problems going on for them. So mental illness, overall, it's caused by genes and environment. So we know this genetic difference that contributes to mental illness are best referred to as conferring susceptibility, vulnerability, or predisposition genes, not causation genes. And in general, mental illness is not inherited. So I think sometimes people think, I'm going to pass on bipolar disorder. I'm going to cause my child to have bipolar disorder. But someone can inherit a vulnerability towards mental illness, but they don't pass on mental illness. And so why is kind of knowing that mental illness is caused by genes and environment important? Or why can it be really important for families to understand cause? We know from research that historically, as medical professionals, we haven't really done the best job of conveying this information to families. And we know that in general, understanding a cause or why it is that somebody has become sick is really important, no matter what it might be that's going on for them. We really like to understand, in general as human beings, why good things and bad things happen to us. So if you think about, say, getting into a car accident, so if you're driving along and you get into a car accident and you think back, why is it that I got into that car accident? And you think, well, you know what? I was texting on my phone while I was driving, and I wasn't paying attention. So if I don't text while I drive next time, that bad thing of getting into a car accident won't happen. And this is very much the same for people and families who are affected by mental illness or affected by bipolar disorder. So they want to understand why this happened so they can have that sense of control or try to do something in future to try to prevent or try to reduce that from happening again. And often, in the absence of explanation or an understanding why something happened, people often look to their own explanations. And unfortunately, sometimes these explanations can invoke a lot of feelings of shame and guilt. So just as an example, this one father said, "It came from my side. I've got the guilt. If I hadn't had him, he wouldn't be like that. If I'd known more at the time, I probably wouldn't have had any children because of what I've seen happen to him. I didn't think about this being passed on when I was 23 years old. You think, this will never happen to me. I would have made different decisions if I'd known." So this father had an aunt with bipolar disorder, and his child now has bipolar disorder. And he was feeling very much like he passed on bad genes, or that he had somehow caused his child's bipolar disorder, which we know is not true. We know that, as I mentioned previously, that bipolar disorder is caused by a combination of things, of genes and environment altogether. Similarly, this other parent shared, "The feeling that we somehow caused this is strong. This happens because we are judged harshly due to our child's behaviors. I was lectured by family members about our parenting skills." So both of these families are experiencing feelings of shame and guilt. And as I'll talk a little bit more about, these are things that genetic counselors are really well trained at addressing with families. So you might be wondering a little bit more, like, what is genetic counseling and what happens in an appointment, and how can this be helpful for you or for your family or for your patients? So genetic counseling, I think, is often thought of as an activity related to pregnancy, single gene disorders like cystic fibrosis, or to conditions for which there's genetic testing, like hereditary breast and ovarian cancer. But it's also a specialist healthcare discipline. So I think I know that there are a lot of there are some psychiatrists and mental health care professionals that have a lot of genetics experience and are quite comfortable providing genetic counseling. But I do think it's important to keep in mind that genetic counselors have specialized training in this field, and they have the time to delve into these issues with patients and clients. So these aren't short conversations that we're having with people. These conversations can be anywhere from an hour to 2 hours in length. So the National Society of Genetic Counselors, which is the largest professional organization of genetic counselors in the world, defines genetic counseling as being for individuals and families who are affected by an illness that have a genetic component. So you can see that really does fit quite well with psychiatric disorders, because as I mentioned, there is that genetic component as well. And it's a process of helping people understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. So a process of actually getting at those feelings of shame and guilt and being able to address them with people in the context of talking about, what do we understand about the causes of mental illness, and what do we know about recovery. And I think because, we call it genetic counseling, often people think what we're focusing on is that genetic component. And so I really do think in the context of mental illness and psychiatric disorders or complex disorders in general, genetic counseling is a misnomer. So we aren't just focusing on that genetic component, but helping people understand the cause of disease. So very much discussing both that genetic contribution and the environmental contribution together. And I think, we talked about how right now there isn't, in most cases, when I'm meeting with people or when genetic counselors meet with people, the family history is what is used to kind of get that best sense of talking about recurrence risks or talking about cause of disease. So we're often not talking to people about genetic testing. And so I think often when we think about genetic counseling, people often think it's the same as or synonymous with genetic testing. And so while genetic testing, if you're going to have that, it's really important, I think, to go for genetic counseling, to go through those pros and cons of perhaps having a genetic test. But genetic counseling is actually extremely beneficial in the absence of genetic counseling is extremely beneficial in the absence of genetic testing. And you may be wondering sort of what sort of training it is that genetic counselors have. So they do a 2-year master's program in genetic counseling. And so there's several schools throughout the United States, and there's a few throughout Canada. So they do this 2 years master's program, and then when they graduate, they write certification exams and in many states within the US, genetic counselors are now becoming licensed as well. So broadly, what happens in a genetic counseling appointment is that we're trying to help people better understand cause of mental illness, as well as how that relates to recovery and trying to reduce risk. And so as I mentioned earlier, I think people often think of genetic counseling in the context of preconception or pregnancy. And so they think about it more in terms of looking at recurrence risks, or what risks might be like for other family members. And while we do talk with people about that, I'd say we spend most of our time talking more about cause and recovery and reducing risk, or things that we know can be helpful in terms of protecting mental health. So some of the things that might happen in general in a genetic counseling appointment is that, as I mentioned, family history is something that can be really helpful in talking about cause and assessing risk. So one of the things that a genetic counselor will start off doing with somebody is taking a very detailed 3-generation family history that focuses on that psychiatric component. And so this might be done over the phone before they meet with the counselor, or at the time of the appointment. And then a question that they will always ask is, what that person feels caused their or their family member's mental illness. And the reason why that's really important is that we know that people are often coming in with their own explanations about what caused their disease. And sometimes these explanations can invoke feelings of shame and guilt. And we know that in order for somebody to incorporate new information into their already existing framework, they need to see how it fits or how it doesn't fit with their explanation. So we need to be able to show them how the research fits with their understanding of how they became sick, in order for that to actually make sense to them personally. So often I think people can say, well, yeah, I see how that's true for someone else, but for me, this is what happened. So we spend, as I mentioned, most of our time focusing on cause and recovery and ways to protect mental health. We talk with people about how we know that everyone has some genetic vulnerability towards mental illness. And we review that people are born with different amounts of this genetic vulnerability, and that some people are going to be, potentially born with higher amounts than others. And for those who, just because somebody has a little bit more starting off doesn't mean that they're going to go on to develop a mental illness, because we know that the environment also plays a really important role. And then we talk about those protective factors. So things like sleep and diet and exercise and social support. And of course, those are super broad topics, really. And so what we spend a lot of time doing is is personalizing that again to that person and to their family. So what do those things mean to them? So how can this help? Um, and I wanted to share some stories with you from my colleague, Dr. Janine Austin, um, about how, kind of trying to illustrate how this can help, because I do feel stories are often the most powerful way to convey this information. So before, and I'm going to talk a little bit about the service that we started, but before we started this service, um, we had done some studies looking at how if genetic counseling could be helpful for people with bipolar disorder, schizophrenia, and schizoaffective disorder. So in the context of this research study, Janine met with this person, and we'll call her Jane, to talk about who wanted to participate in our study. And so she met with Jane for genetic counseling. So when Jane came in to meet with Janine, Janine was really struck by how empowered Jane appeared. So Jane had a personal diagnosis of bipolar disorder, and she was very open and out about having bipolar. Such that people at work were aware of her diagnoses, and they wrote news articles about how well she was doing. She was in a very hard position at work, and how well she was doing. And so, starting off, Janine asked her, "What do you feel caused your bipolar disorder?" And Jane said, "Oh, it was genetics." Janine said, "Okay, so what sorts of things were going on for you around the time you first became sick?" And Jane listed off this laundry list of really horrific things that happened to her around that time. And Janine asked her, "Well, do you think, that sounds like it was a really hard time for you. Do you think any of that may have contributed to you becoming sick?" And Jane said, "Yeah, it was a really difficult time, but for me, it was all genetic." So Janine started talking to her about how we know it's both genetic and environmental, and going through how that would fit kind of in terms with her experiences. And notice the color draining from Jane's face. So she stopped and checked in and said, "I'm noticing a change here. What's going on for you?" And Jane said, "Well, if I'd known it was anything other than genetic, I wouldn't have told people. They would think it was all my fault." And so Janine was quite concerned that perhaps she had, crushed this very empowered woman, and so was actually trying to show her that because we know it's not all genetic, there are actually things that we can do to help with recovery and things that we can do to help protect mental health. So some of the things I haven't told you about Jane is that while she was very open and out about having bipolar disorder, there wasn't really doing much, and her mental health wasn't that great. She had been on the same medication for several years, and it really wasn't doing much in terms of managing her symptoms. She had sleep apnea, and sleep apnea with bipolar disorder is not the best. Um, and she was overweight, so there was a lot of different kind of factors going on for her. And so Jeannie was trying to show her that because we know it's not all genetic, there are things that she could try to do to help improve her mental health. But didn't really feel like Jane was taking any of it in. And so at the end of the appointment, they had contracted that because it was in the context of research, that a research assistant would be coming in to finish off some questionnaires with Jane. And she was, shaking Janine. She shook Jane's hand, and Janine had her hand on the door handle. And Jane said to her, "Well, if we'd known it was anything other than genetic, we would have had more children." And started to cry. And Janine tried to stay and talk with her more about it, but felt the only reason why she shared that with her is because she knew that Janine was leaving. And of course, whenever we feel like someone's been upset by a genetic counseling appointment, we try to follow up with them quite quickly so that we can talk to them more about it. We standardly do a 1 month phone call, a follow-up phone call, but we would have actually been in touch with Jane much sooner than that. But before Janine could be in touch with Jane, Jane was actually in touch with Janine and had sent her an email to say that she had got herself a psychiatrist because she didn't have one previously. She'd found a new family doctor who was more willing to work with her on her sleep apnea. She was taking a new medication. It was already kind of noticing that it was helping, and she'd started going for daily walks. So you can see how it can be really important for somebody to understand that it's both genetic and environmental, and how that can really help them with their recovery process. I wanted to share another story with you, again in this context of the same research study. And so again, Janine was meeting with a participant, and we'll call him Bob. Sorry, just a moment, I'm gonna have some water. Excuse me. And Bob had a diagnosis of schizoaffective disorder, and he was currently in hospital. Excuse me. He was currently in hospital for a recent suicide attempt. And so he saw one of our flyers for our research study and called us up and wanted to participate. So Janine met him on board for his genetic counseling appointment. And in the context of sort of starting, kind of getting to know him and asking him some questions, she learned that Bob actually had a master's in looking at those genetic variants that are involved in causing schizophrenia. And that's what Janine had done her PhD in. So they had a nice little chat about that, a bit of a geek out session. And so more out of habit than anything, she asked him, what do you think caused your schizoaffective disorder? Assuming that the answer would be genes and environment. Without skipping a beat, Bob said, poor life decisions and weak character. So Janine said, okay, well, what about that master's that you did in the genetics of schizophrenia? And he said, well, yes, I see how that's true for other people. But for me, it was weak character and poor life decisions. So as I mentioned, something that we always do is a family history with somebody. So Janine went through and did his family history. And in the process of doing that with him, he told her that his mom had recurrent severe depression and his dad had bipolar disorder. So Janine went through the family history with him and showed him that he likely would have inherited some genetic vulnerability from both of his parents. And as she went through that with him, he broke down and started to cry and said, for the first time in 20 years, he realized that perhaps it wasn't all his fault, and he felt like a weight of guilt had been lifted. Something I haven't told you about Bob is that the reason why he was still in hospital is because he was refusing to take his medication. And he was fighting with his psychiatrist. The psychiatrist wanted him to take his medication. Bob did not want to. And you can imagine, for somebody who feels that the cause of their illness is all due to weak character or poor life decisions, for them it doesn't feel like it makes sense to take medication. So as I mentioned, we always do a 1-month follow-up phone call. And so when Janine followed up with Bob 1 month later, he shared with her that once he understood that for him personally, there is this biological component to his disease, taking a biological treatment actually made a lot of sense to him. And so he'd actually stopped fighting with his psychiatrist and he'd started taking his medication. So you can see kind of from both angles, that thinking that the harm it can cause for somebody to think that their disease is caused by all genetics, and the harm it can cause when they believe it's all environmental. And so it can be really helpful to understand that there's contribution from both. And I think also really important to note that neither of those individuals were contemplating having a pregnancy. So we weren't talking about recurrence risks for either of them. It was more talking about how does somebody become sick and how does somebody recover. So in the context of our service, I wanted to share another story because I think it can really show how talking about recovery and protective factors, how that's really helpful for somebody. So I'd met with a patient, and we'll call her Jill, and Jill had depression, but it wasn't was currently feeling depressed. And when I met with her initially in the appointment, she was not comfortable talking about her own personal mental health. She was there to talk about her adult son who had bipolar disorder. And it was probably about 2 hours into the appointment. So again, these are not short conversations we have with people, that she started to talk more about her, opening up a lot more about her experiences with depression, and was sharing that she felt like there wasn't anything that she could do to help cope with her experiences with depression due to her circumstances. So being a caregiver for an adult child with a mental illness, and feeling like she needed to put everything that she had into taking care of him and being a support person for him. And so we'd gone over a few times talking about the importance of sleep and exercise and diet and social support. But it wasn't until that 2 hour point when when she spoke about this, how she really couldn't take that time, that we went back to that again and talked about how, if she can't take that time, for herself to do those things, then it's going to be really hard for her to continue to be that support person, that advocate for somebody else. And that, it's likely that she'll become more depressed if she's not able to try to do some of those things to try to help her mental health. So we went through this a few times, and she shared that she'd had an epiphany, that other people had told her this before, but it was the first time that it actually resonated with her. She shared that she liked to go running and liked to do yoga, but often was made to feel guilty by other family members for taking the time to go and do those things. And so while and before she hadn't really saw the point of doing them, because she shared, it won't fix my situation. And she began to cry and said that, that people had told her that she was selfish for wanting to do these things to help her cope. But she was now realizing how important it was for her, and compared it to this idea of putting, when you're on the airplane, you need to put that oxygen mask on yourself first before you can help somebody else. Because if you can't breathe, you can't be that person to help help somebody else. And she thanked me again for taking the time to go through that all with her. And really, if that had been a 15-minute conversation, we would never have been able to build that rapport, to get to that point where we could really get past her initial feelings of defensiveness to have that conversation. So we really do spend a lot of time on that first point there. So helping people better understand cause, as well as how that relates to recovery and reducing risk. But people also do sometimes want to know more about what chances might be for other family members, what that might look like. And so why is risk perception so important? So We did a survey a while back that asked first degree family members what they thought the chance was for someone who has a brother or sister with psychosis to develop psychosis themselves. And so the correct, in quotation marks, number would be that 10%, so the one with the star above it. Then we also asked them if a family history of mental illness has affected their reproductive decision making. And for those people who said yes, we asked them by how much. And so that's what you see along the y-axis. And what we found was that the more people overestimated the risk for psychosis or mental illness, the less likely they were to have children. So while this is, not everyone wants to have children, and that's totally fine, it's a huge life decision to decide whether or not to have a child. And people should be making those decisions based off the most accurate information available. And so, yeah, I think, so the reason why I kind of put that 10% in quotation marks, this number, basically these are empiric risks. So they don't fit for everybody. We know that if somebody has, 3 generations of schizophrenia, their chance is going to be higher than 10%. If we're meeting someone for the first time and they have a first degree relative with bipolar disorder and they're 50, their chance is going to be very different, and it's going to be much lower than that 10% versus if we're seeing that person and they're 15. So we actually take into consideration the detailed family history. So what's going on in that family, how old that person is, and if they've had any sort of symptoms. And we're able to use all of that information together to give somebody a personalized risk estimate. So how someone perceives risks is a very individual experience. So what one person will perceive as being low in one context, they might perceive as being high in another context. So for example, it's that difference of, what does bipolar disorder mean to you? What has your experience been like with that? Is it similar to if I was to tell you that it might snow tomorrow, there's a 10% chance of snowing tomorrow versus there's a 10% chance there will be a tsunami tomorrow? How is that? What has your experience been? People will perceive those risks very differently. And then this is just sort of to go that those numbers that you find on the internet can be really misleading because it does depend on the number of people in the family who are affected and how old that person is. We take a lot of information into consideration in a genetic counseling appointment. And we like to put that all into context for that person. So I wanted to share a little bit. I kind of alluded to the fact that we had started a clinical service here in BC, or British Columbia. So we had all this evidence that showed that genetic counseling could be helpful for psychiatric disorders based off of the research that we've done. And we also had research evidence showing that people want to receive genetic counseling for psychiatric disorders. And in BC, a lot of people actually hadn't been accessing that service. So they were wanting it, but not getting it. So that's why we decided to start this more specialized service. So just to share a little bit about it, it's a free clinical service for all our BC residents. And we do appointments over the phone, in person, via video conference. And we essentially, like the way we work is we write consult letters back to all our referring healthcare providers, and we have access to all sorts of different interpreters. So language isn't a barrier. And I think for genetic counseling service outside of BC, this is also true, that genetic counselors will often accept referrals from all sorts of healthcare providers, and they will often also have access to interpreters. So just because someone speaks a different language doesn't mean that they can't access that service. So the way we've structured our particular clinic is that we do a detailed family history over the phone before we meet with someone. And our appointments are anywhere from an hour to 2 hours in length, really dependent on the person. We often do a 1 month follow-up phone call with the option of more appointments if the person has some more things they would like to discuss, or if they maybe want to bring in another family member to a subsequent appointment. And most of our patients will complete clinical assessment tools during the appointment and at the 1 month follow-up appointment. And the reason for these assessment tools is so the two that we use are the Genetic Counseling Outcome Scale. And the reason why we use this one is that it gets at those issues of guilt. So asking questions like, I feel guilty because I might have passed this condition on to my children, or I don't know where to go to get the medical help I or my family needs. So it helps us right away assess some things that maybe that person wouldn't have been bringing up otherwise during the appointment, but perhaps they're questions that they have. Or, sorry, excuse me, sometimes it gets at questions that they actually didn't even realize they had coming into the appointment. The second questionnaire that we use is the Illness Management Self-Efficacy Scale. And this is for people who personally have a mental illness. And it's trying to get more at how are they doing right now? Do they feel like they can do different things to help manage their mental illness? And it helps us, if person is rating that a bit lower, maybe spending a bit more time discussing those protective factors, those things that we know can help with recovery. So again, we can helps us personalize that appointment to the person that we're meeting with. And sometimes, we're meeting with more than one person, so everyone's going to be coming from a different place. So it helps us, again, try to individualize that to each of the people that we're meeting. So what have we found from the kind of very briefly from the first year of our service? So we started back in February 2012. So we really wanted to know why people were coming in. What were their main questions? And so what we found was a lot of people really wanted to know what chances might what they wanted to know was understand the causes of mental illness. A lot of people also really wanted to know what chances were for other family members. And people were also interested, less people, but I think kind of at the beginning of the appointment, wanted to know about protective factors. But as we began discussing it more, that ended up actually being a big part of most of our conversations. We found that genetic counseling increases empowerment and increases self-efficacy. So empowerment is defined as a set of beliefs that enable a person from a family affected by a genetic condition to feel that they have some control over and hope for the future. Self-efficacy is sort of how confident or able someone feels they are to complete tasks or reach goals. And so I'm running a little short on time, but just really quickly, a last story is that I had met with a patient who she had several family members on her dad's side of the family with bipolar disorder and depression. And she had 3 boys, and 2 of her boys had bipolar disorder and 1 of them had depression. She herself hadn't experienced any mental health problems. And so when I met with her, she shared that she had felt very much like she caused her children's mental illness. And when I followed up with her 1 month later, she was able to share that when we talked about guilt, by going through that questionnaire again, she shared that she had felt very, very guilty until she'd had genetic counseling. And then she realized that it wasn't something that she was causing in her children. She shared that she was able to notice that one of her sons, when he became very depressed in the past month, but realized that a big contributor of that depression was some stressors that he was experiencing with his relationship. And she was able to see that it wasn't something that she was directly causing, that it was something that was kind of an environmental stressor that was going on for him, and was realizing that it wasn't her fault. So really quickly, we know that I hope I've been able to show you that genetic counseling can be really helpful for families with psychiatric disorders, and it's ideally suited at reducing these feelings of guilt and shame. And it can really help people understand causes, chances for other family members, and ways to protect mental health. So overall, understanding this can help families adapt, and having a more accurate perception of risk can have a profound impact on life decisions. And it's really not about just providing somebody with information. These are we really get into more talking about how this personally affects that person in an individualized way. And they're not quick chats that we're having. As I mentioned, that was on the longer side, but that one appointment I had was over 2 hours. And that was really important to be able to have that time to spend with that person so that we could really get at those things for her. Um, and again, I think it can be really helpful for people with mental illness and their families. So you might be wondering, wow, this sounds so fantastic. How can I find a genetic counselor in my area? So there's lots of different sites that you can go to. So if you're in Canada, you can go to the Canadian Association of Genetic Counselors. If you're in the States, you can go to the American Board of Genetic Counseling or the National Society of Genetic Counselors, and you can search genetic counselors. And if you're in British Columbia, Canada, you can give me a call. I see people all over the province here. Oh, so that's everything. I don't know if I think we have some time for questions.
Yes, thank you, Angela. That was wonderful. First question, are there any psychiatric conditions for which genetic pathways have been reliably established?
Any psychiatric conditions?
Yes.
Uh, Sorry, what was the question again?
Are there any psychiatric conditions for which genetic pathways have been reliably established?
Um, I don't think, if I'm understanding the question correctly, in terms of like maybe getting at like, do we know that neurotransmitters are involved, like dopamine and glutamate and those sorts of things? So we do know that certainly genetic pathways within the brain are involved, but we really don't understand all of the ins and outs for different psychiatric conditions. So if I'm understanding it correctly, no, not at this point.
Okay, thank you. Next question. What are some main environmental reasons that cause mental illness?
Okay. So there's no environmental reasons that will cause mental illness. There are some environmental factors that can contribute. Um, and so they're super individual from one person to the next. It really depends on the person. But some of the ones we know from research, having like a childhood and sorry, head injury can contribute. Um, we don't know why this is, and it's not by a big factor, but being born in the winter months can contribute a little bit. Immigrating from one country to another, so you can imagine that's a huge cultural change, a big change in your social group, can contribute. And drug use can contribute. So things like marijuana or methamphetamines. But none of those individually would cause somebody to become sick.
Great, thank you. Can you elaborate more specifically about genetic vulnerabilities with examples, if possible?
Okay. So at this point, really, where there are just sort of, um, I guess, there are some conditions where we know there's I guess a larger or genetic vulnerability. So we know a condition like 22q 11.2 deletion syndrome. These people have a higher chance of experiencing a psychiatric disorder. Um, so versus sort of the 1 to 2% or 1 to about 3% of the general population to experience psychosis they have about a 30% chance to experience something like psychosis or other mental illness. And but they have other problems. Usually there's other things going on, like they might have been born with a heart defect or have immune problems as a small child. They might have speak differently, speech problems. So those are some of those conditions where we're talking about where perhaps when we're seeing those features, we might think about genetic testing. And there's some other ones where if we're kind of know of somebody in the family having those particular genetic changes, or there's a family history that's suggestive of that, that's when we would do genetic testing. But otherwise, there isn't any genetic testing that we do at this point. And so these are when we're talking about genetic variations, they're just really small, sometimes almost like single letter changes in our genes that might make it so that when we look at a huge group of people, we might see those changes and more often in a group that have schizophrenia versus the general population. But again, we're not at a point where we know of anything being causative towards mental illness, but that things can contribute to mental illness.
Great, thank you. Next question. Low penetrance genetic variation in the population is beginning to help people with fairly common conditions that have a genetic contribution through more precise, personalized risk estimation and tailored care. How do you think neurogenics and neuroscience will change the care you can give people with or at risk of mental health conditions over the next 10 years?
Very interesting question. So, I mean, hopefully, over the next 10 years, maybe we will understand a lot more of the differences between, why it is you give one person lithium who has bipolar disorder, they do really well and have very, minimal or no side effects. Whereas you give it to somebody else who's the same sex and the same age, and they have terrible side effects and it just doesn't work for them. So I'm hoping that in the future that understanding some more of the differences between how we metabolize or how we use medication genetically, that will really help with treatment for people with mental illness. I'm hoping that that's sort of in the next 10 years, but I don't know. And I think just in general, these things have all already, taken a bit longer than we thought in terms of trying to understand all of the causes on all of the things that can contribute. But hopefully in the next 10 years, pharmacogenetics will be able to tailor more how we treat somebody who's sick.
Great, thank you. Similarly, if we really get to understand how genetics influences the cause and biology of mental illness, what impact will this have on your service? And will there be a greater uptake of genetic counseling and will there be much to be gained from predictive testing?
So we're never going to be at a point where we can predict who will go on to develop a mental illness and who will not, because the environment actually plays a role as well. So in terms of predicting, we won't be able to do that, but perhaps we can provide somebody with that personalized risk estimate. So it may be if we understand all of the genetic variants that might be involved, then being able to give somebody, as opposed to basing that off of their family history, then maybe looking at that more that genetically. Would that increase uptake of the service? It might. But sometimes I think it again depends behind the motivation of somebody wanting to come in. So a lot of the people that I do see want to understand more why it was they became sick. For some people, if we're thinking about it in terms of what chances might be, not everybody wants to know that. So for some people that's not going to change whether or not they want to come in for an appointment, or that might not be testing that they want to have. We know for a lot of conditions where there's um, where we're able to provide people with risk estimates based off of genetic testing. Um, Sometimes there's a lower uptake of that testing than we would have thought, um, because then it kind of comes to that question, do you want to know that information?
Thank you. How close are we to a cure?
Um, oh, yeah. At this point, I think we're quite far away from a cure, um, for mental illness in general, because we still don't understand. I think part of trying to find cure is understanding cause, and so we're still in that process of understanding cause. Um, and in terms of cure, I do see that perhaps in future we'll understand better about treatment, and I think that would really change what mental illness means for somebody. So I mean, hopefully that's in the near future, more better ways of treatment versus I can see that more in the future, better ways of treatment versus being able to cure someone. And in general, in conditions where we have, we know that it's one single gene that's involved, we're not at a point where we can cure somebody from that, from those conditions.
Thank you. Is genetic vulnerability usually based on the history, including family history?
So when we're talking with somebody about what chances might be, where we go through we base those chances or those recurrence risks off of the family history. Um, so, but we can never actually individually, we can't at this point individually say how much genetic vulnerability a person would have. Um, we can kind of say what the chances might be for someone to develop a mental illness, but we can't say for sure um, sort of how much genetic vulnerability somebody might have. Um, because there's that environmental component as well, so it can be difficult to tease that apart. We can provide our best risk estimate based off of the family history. We can say, it could be that there was more genetic vulnerability in your family, because there are so many individuals who have mental illness. But we can never really exactly say that they necessarily inherited more or less, because we can't actually go and look at this point. We can't do that genetic testing because we don't understand all of the genetic variants that might be involved.
Great, thank you. How great is the environmental factor versus the genetic factor?
No, these are great questions. I love it. Oh, you guys should all come in and we can have a chat. Um, yeah, no, this is a very common question people want to know. So, how much of it was genetic? How much was it environmental? Um, and there's no way to really say. They both play a role, and it's going to be different amounts depending on the person. So you could imagine that one person might be starting off with more of that genetic vulnerability. And so we use this sort of analogy of a jar. And so they might be starting off with their jar maybe a little bit more full than, say, somebody else. And then it doesn't take as much of those life experiences or those things that they perceive as being stressful, essentially, to fill up their jar. Whereas somebody else, perhaps they started off with less of that genetic vulnerability, or they had their jar started off being less full. And it would take more of those life experiences and more of that, of those stressors. And these can be things that we might perceive as being a negative event, or things that we might be quite excited about, but also cause a lot of stress kind of with that. That may contribute and fill up their jar. So they've kind of reached their threshold and they become sick. Um, and so it's a combination of things for everyone. And people can start off at different places in terms of their genetic vulnerability. So you can't really say how much of it was more genetic for one person or environmental for another. I know some people, we kind of say that, perhaps somebody who became sick at a younger age, um, perhaps they start off with a little bit more of that genetic vulnerability versus somebody who became sick maybe at a later age. Perhaps they started off with a little bit less of that genetic vulnerability.
Thank you. Could the death of a parent at an early age be an environmental factor in mental illness?
Most definitely. I think um, it's really any of those events that we perceive as being stressful, and that's a huge life change. And I mean, in general, we know those like moving from one country to another, or the breakup of a relationship, the death of someone we care about, all of those things can contribute to someone developing a mental illness. And it's not necessarily that somebody passes away and then that person will become sick. It might just be something that contributes, and then perhaps later on they experience some other stressful life events, and then they experience symptoms. But most definitely that can contribute.
Great. Thank you, Angela. This has been a wonderful webinar, and I think we are out of we are out of questions. So thank you very much. Appreciate it.
Oh, thanks so much for having me. And please do email questions if you have any. And if you are in the BC area and you're interested in an appointment, please feel free to give me a call or send me an email. I apologize if we started a little bit late today. I had some technical difficulties, so appreciate your patience and everything.